This medication is commonly used to treat many different types of bacterial infections. It belongs to the penicillin group of antibiotics and works by preventing bacteria from growing. Nafcillin Solution, Piggyback Premix Frozen is typically administered by a healthcare professional through and for, and the dosage and timing will be determined by your doctor based on your specific condition. It's important to follow your doctor's instructions carefully and to complete the full course of treatment, even if you start to feel better. This medication is given by injection into a vein as directed by your doctor, usually every 4 to 6 hours. The dosage is based on your medical condition and response to treatment. For children, the dosage is also based on weight. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. Give aminoglycosides, such as gentamicin, separately from this medication. Do not mix together in the same fluid. For the best effect, use this antibiotic at evenly spaced times. To help you remember, use this medication at the same times every day. Continue to use this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Tell your doctor if your condition lasts or gets worse. If this medication is injected into a muscle, you may experience pain at the injection site. If this pain persists or worsens, be sure to notify your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to tell your doctor immediately if you experience any serious side effects, such as pain, swelling, or skin peeling at the injection site, if the drug is injected into a vein, joint or muscle pain, signs of kidney problems, extreme tiredness, easy bruising or bleeding, signs of infection, seizures, uncontrolled movements, confusion, irregular heartbeat, muscle cramps, or weakness. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you experience persistent diarrhea, abdominal pain, or blood/mucus in your stool, contact your doctor immediately. Do not use anti-diarrhea or opioid products as they may make the symptoms worse. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or any other new symptoms. Although very rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before using Nafcillin Solution, Piggyback Premix Frozen, it's important to inform your doctor or pharmacist if you have any allergies to penicillin or cephalosporin antibiotics, or if you have any other allergies. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. Inform your doctor or pharmacist about your medical history, especially if you have asthma, kidney disease, or liver disease. It's important to note that this medication contains sodium, which could affect individuals on a salt-restricted diet or those with conditions that could be worsened with an increase in salt intake, such as heart failure. It's best to consult your doctor or pharmacist for more information. Nafcillin may also cause live bacterial vaccines, like the typhoid vaccine, to not work effectively. Make sure to inform your healthcare professional that you are using Nafcillin before having any immunizations or vaccinations. It's essential to be aware that older adults, newborns, and infants may be at a greater risk for side effects while using this drug. If you are pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, as this drug passes into breast milk, it's crucial to consult your doctor before breastfeeding while using this medication. Drug interactions can affect how other medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without your doctor's approval. Some products that may interact with Nafcillin Solution, Piggyback Premix Frozen include blood thinners, such as warfarin, methotrexate, and tetracyclines. This medication may speed up the removal of other medications from your body, which can affect how they work. Examples of affected drugs include daridorexant, elacestrant, certain products used to treat chronic hepatitis C, isoniprevir, ombitasvir/paridaprevir/ritonavir, quizartinib, among others. Nafcillin Solution, Piggyback Premix Frozen may decrease the effectiveness of hormonal birth control such as pills, patch, or ring, potentially leading to pregnancy. It's important to discuss with your doctor or pharmacist whether you should use reliable backup birth control methods while using this medication. Also, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding, as these might indicate that your birth control is not working well. This medication may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If someone has taken too much Nafcillin Solution, Piggyback Premix Frozen and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help immediately. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and changes in mental or emotional state like agitation. It's essential to seek medical attention right away if you or someone else is experiencing these symptoms after taking Nafcillin Solution, Piggyback Premix Frozen. Medical professionals may conduct lab and/or medical tests to monitor kidney and liver function, as well as complete blood count while you are using Nafcillin Solution, Piggyback Premix Frozen. It is important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Nafcillin Solution, Piggyback Premix Frozen as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. This medication is typically administered intravenously by a healthcare professional, and the dosage and frequency will be determined by your doctor based on your medical condition. It is important to follow your doctor's instructions carefully. Taking this medication at the same time each day will help you remember to take it. Be sure to consult the product instructions and your pharmacist for specific storage details. It is important to keep all medications out of reach of children and pets. Do not flush medications down the toilet or pour them into a drain unless you have been specifically instructed to do so. It is essential to properly discard this product and it is expired or no longer needed. For guidance on how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.